Hello everyone, welcome to my YouTube channel. Today I'm going to be talking to us about one of the questions that someone has been asked when the person went for histopathology interview. So someone has been asked if the person could explain or how to dissect uterus that is connected with the cervix. So before we continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. The way the question was actually addressed to the person was, how do you dissect uterus? How do you dissect uterus with the cervix attached? How do you dissect uterus with the cervix attached? I want you to know that, remember that this very uterus and cervix, because of the way it is connected within the lining, okay, it is important that when dissecting, that one is very careful in the sense that, during the dissection, there can be a possibility that one could make a mistake, and that mistake could lead to diagnosing something that is from the cervix to be for the uterus, or something from the uterus to be from the cervix. So that is why one needs to be very, very careful. So their carefulness, the carefulness can then help us to be able to preserve the anatomical structure of this cervix or uterus. I hope that makes sense, okay? And that preservation is not just for the diagnosis or for effective diagnosis, it can also help for teaching purposes. If we're going to do dissection, there are many things obviously we need to consider that we're going to use. We can use scalpel or dissection scissors. We can use forceps. We can use dissection pin. We can use dissection tray. We can use, of course, hand glove. We can use ruler. So the ruler can help us to be able to measure the sizes and so on. And of course, following the dissection and all of that, there's also need to make sure that, of course, the tissue will come with a fixative anyway, but then we also make sure that we preserve it using a fixative like maybe formaldehyde. I hope that makes sense, okay? So I've mentioned when we want to dissect tissue, including the cervix or the uterus, we now need to consider we need to use scalpel or dissection scissors. We need to use forceps. We need to use dissection pins, dissection tray. We need to use hand glove, obviously. Of course, you also need to have your lab coat, and then you need ruler to be able to measure the sizes. And of course, after all of that, put it in a fixative. I hope that makes sense. Now, this is very, very important because, like I mentioned before, the connection between the uterus and the cervix are very close, okay? And because of the close connection between the uterus and the cervix within the lining, it's important that when we are handling the tissue attached together, that we are very, very careful in doing that, okay? So that is why I believe this question has come. How would you be able to dissect, cervix attached with the uterus, or uterus attached with the cervix? So it's because of how close range the connection is with the lining and all of that. So it's important that when we are dissecting, we dissect it carefully to make sure that each of the anatomical structure is well preserved. Now, the next thing we're going to look at, what are the step-by-step that can be used to be able to dissect this very uterus with cervix. Number one, of course, you have to do preparation, okay? Then in your preparation, there's a need to consider safety first, okay? Because remember, like applicable in other laboratory procedure, whenever you're doing every laboratory procedure, okay, you need to make sure you consider safety first. So in that consideration of safety first, that is where your PPE comes in, okay? So which is your personal protective equipment, that is where it comes in, and that obviously includes your hand glove, include your lab coat, include your eye protection, okay, and so many other things. Then after that, then there is a need to be able to properly position the tissue very well. That position can help you to be able to make sure that you are very careful when you are dissecting it. So how are you going to position the tissue? You need to position the tissue by placing the sample, which is now the uterus and the cervix. You now need to place it on the dissection tray, okay? You place the sample, that is the tissue sample, on a dissection tray, okay? Now, and you're going to position it anteriorly, meaning that you need to position it, the front side facing forward, okay? So that way you can be able to see what you are looking for very well. So the best way to position it is anteriorly, okay? That anterior position will help you to grasp a better view of the tissue. I hope that makes sense, okay? Now, what that means then, that once you have considered the safety, the next thing you now need to look at is to look at initial examination. What does that mean? Like in all the histopathology tissues, not just on the cervix and the uterus. Once any tissue is to be cut, okay, or dissect, you need to first of all do initial examination, and that initial examination include external inspection. So you need to look at the tissue. What are the sizes of the tissue? What are the shapes? What are the visibility abnormality you can see? Meaning, basically, what can you see? What are the size? What are the shape? Is there any abnormalities that you can see? Whatever thing you can see, obviously, you record the sizes, you record the shape, and you record any of the abnormal, anything you observe regarding abnormal. Basically, in that external inspection, whatever thing you can see with your eyes that you have measured, as the case may be, you record it properly. The next thing you are going to do is identification of the structures, okay? So you are now trying to find out this structure, this tissue that I'm having now, what are the landmark of its anatomical structure, okay? So you need to make sure you identify the structure, everything is in the place, so you are considering the landmark of the part. For example, what are the landmark of the cervix? What are the landmark of the uterus? So you are making sure that everything are where they're supposed to be. So these things are going to form part of your initial examination. So whatever thing you observe, obviously you document it. I hope that makes sense. Yeah. Then still in the further steps, the next thing you can add after you've done that initial examination, of course, then the next thing now is to do the dissection itself. So in dissecting the uterus, okay, you're going to now dissect the uterus. Remember, you also dissect the cervix because they are connected together. Then you need to make sure you carefully do the dissection in such a way, like I've said, there won't be any mistake, because that mistake can lead to mixed diagnosis, something that's in the cervix to be in the uterus or vice versa. Okay, so now what it means that when we are dissecting the uterus, we need to now consider what we call longitudinal incision. Okay, so we need to dissect it by longitudinally. So the longitudinal incision will really help, and this is going to help to avoid any form of damage in the endometrium. Okay, so this longitudinal incision can help us to avoid any form of damage in the endometrium. Okay, now, and that thing will now help you. The longitudinal incision can now help you to be able to open up the uterus. Okay, and once you open up the uterus, then it can help you to be able to look at the uterus. Okay, that means it can help you to be able to inspect the endometrium. Remember that this endometrium now is now inside the uterus, so you cannot be able to inspect the endometrium. So number one, what you do is a longitudinal incision that will help to avoid any form of damage in the endometrium. Then obviously that will now lead you to be able to open up the uterus, and then you can now be able to inspect the uterus. Now, when you inspect the uterus, what exactly are you looking at? You're looking at the anatomical structure. Everything is in place. So for example, you're looking at the uniformity. Okay, so you're trying to find out the uniformity, and then you want to look at the thickness. Okay, and of course you now want to look at if there's any signs of any form of pathology, like in forms of polyps or fibroid or any form of abnormal growth. So once you open it up, you are looking at the structures. Is everything the way it's supposed to be, or is there any abnormalities? And that's why you can look at the uniformity of the endometrium. You look at things like the thickness of the endometrium. You look at any signs of pathology, like I've said, in form of fibroid or any abnormal growth or polyps, as the case may be. Okay. Now, similarly again, when you come to the dissection of the cervix, then you also do the cervical incision, and once you've done the cervical incision, again, you can be able to inspect the cervical canal. So that will help you to be able to, the incision will help you to, will expose the canal, then you can be able to inspect it. And what are you expecting? You are now trying to make any form of observation, okay? So you can be able to observe the transition zone. That transition zone is what is called squamo-columnar junction. So that squamo-columnar junction is what you call a transition zone. So you do the incision, okay, then you can be able to observe the canal. Now, because you have done the incision, you have done the observation and all of that, the next thing that you now need to look at, remember that these very, whether cervix or maybe uterus, they have epithelial linings. So now, in a case of abnormality like cancer, as the case may be, or precancerous cells, the lining is likely to change. And that is the essence of the observation. So you cannot be able to do epithelial lining changes observation. So you want to find out, is there any changes with the lining of the epithelial cells? Okay, so there are two main common epithelial cells you are going to see in things like columnar epithelial cell or squamous epithelial cell. So when it comes to columnar epithelial cells, it can be mainly reside inside the cervical canal. Okay, and when it comes to the squamous epithelial cell, you can see it in the external cervix, as the case may be. Okay, so what that means is that you want to find out, to make sure there's no any migration of maybe change in the lining of the epithelia in such a way that maybe columnar epithelia will now be found into the external cervix and the squamous epithelial cells are formed inside the canal. So once you notice any of that observation, then obviously you need to record it. Why? Because this area is crucial for cervical pathology. So while you're looking at the cervical canal and external cervix, is because it's very, very important for what? For pathology, okay, in decision making. So it's crucial in cervical pathology. Why? Because it helps us, that area will help us to be able to easily identify any form of precancerous lesion. Okay, so any form of precancerous lesion can be found either in the cervical canal or maybe the external cervix. And one of the things that can help us to know if there is any of such suggestion is the change in the migration, the change in the epithelial lining of the maybe the columnar or maybe the squamous epithelial cells, like I have mentioned. Okay, now optionally you can decide to then do further examination where you can do something like cross-sectional cut, and that can give you a better view, okay, of the layers of the cervix or the uterus, as the case may be. And of course you can also decide to examine the fallopian tubes and the ovaries as well. By carefully dissecting the fallopian tube and the ovaries, it can also give you a better view of this very lining that can enhance in the decision making of whether there is any abnormalities or not. I hope that makes sense. So what I've said, that in dissecting this very uterus connected with the attached with the cervix, is important we are careful so that we can be able to maintain the anatomical structure of each of these very parts of the reproductive female system. I hope that makes sense. Okay, and that is where we're now talking about how you can be able to position it, the dissection and the materials you can use as already highlighted. The bottom line when it comes to the dissection then is to make sure there's no any mistake, so that whatever thing that is being seen in the uterus is associated with the uterus, and whatever thing that is seen in the cervix is mainly associated with the cervix. Now I've said that once the dissection has done, okay, now the next thing is to now look at the epithelial lining changes. So that will help us to be able to see if there is any form of abnormalities. And one of the ways to see is, of course, observing what you can see to see whether are you seeing columnar epithelial cell, or are you seeing squamous epithelial cell, and where exactly are you seeing them, like I have previously mentioned. I hope that makes sense. Yeah. Now, in view of that, then after we've dissect the tissues, okay, now carefully done the dissection and carefully recorded all our observation, and of course do the normal histopathology or special stain, as the case may be. Now, if there are any form of abnormalities, there are some conditions that it can be associated with, which I'm going to just try to list for you. You can see something like cervical intraepithelial neoplasm, okay, which is called CIN, cervical intraepithelial neoplasm. There can be something like squamous cell carcinoma, okay. Now you can have something like adenosquamous carcinoma, and you can have something like small cell carcinoma. So we can also see something like sarcomas, okay, then or metastatic carcinoma, okay, or you can chronic cervicitis, or maybe adenomyosis. So these are some examples of some of the abnormalities that can be seen in this very reproductive, female reproductive system, okay? So, and that is why it's important that during dissection, you carefully do it, because these two parts is closely related, and it's important that we don't make any mistakes, so that what's any of this that is being identified in the uterus, we now know that it's certainly the uterus, or if it's identified in the cervix, it's certainly the cervix. I hope that makes sense. Yeah. Now, once you have known that, then the next thing you then need to do, obviously, is to record your findings, okay? So record your observation or pathological finding, as the case may be. You can take photograph where possible, okay? The taking of the photograph, can be used, of course, not just for the recording purposes. It can also be used for teaching purposes as well. And of course, it's important that the samples are well preserved in such a way that you never know, in future you can always refer back to it, or maybe if there's any question regarding the result that has been provided or reported, then you can always refer back to the tissues. Why? Because it has been preserved. I hope that makes sense. Yeah. In conclusion, dissecting a uterus with the cervix attached will help to provide a valuable insight. That means it will help to understand, the anatomical structure and any potential pathologies, okay, of the female reproductive system. So why it is important that when we are dissecting it, we are very careful, is because it's going to help us to be able to know if there is any abnormalities in this very female reproductive system when it comes to looking at the anatomical structure, or maybe if there's any potential changes that can indicate any form of abnormalities. So that is one of the reasons why this dissecting uterus with the cervix is very, very important. And that was why I have said that the procedure hence require a careful handling. Of course, that way, that careful handling can help to be able to preserve the structure and thereby enabling effective examination, leading to accurate diagnosis. And of course, that can also help, for effective teaching purposes. I hope that makes sense. Okay. Thank you very much for listening. Do let me know what you think about the video. And please, can I ask you to like, share, subscribe? Thank you, and I wish you all the best till I come back your way again. Bye-bye.